Hello and welcome. Today we're diving deep into a fascinating, though sometimes uncomfortable, topic: acyclovir-induced nephropathy, or as it's more commonly known, acyclovir stones in the urinary system. We'll explore everything from what causes these stones to how they're treated, and, most importantly, how to prevent them. So, what actually causes acyclovir stones to form? Well, acyclovir is an antiviral medication primarily used to treat herpes simplex virus infections like genital herpes, shingles, and chickenpox. The problem arises because acyclovir has relatively low solubility in urine, especially in acidic environments and at higher concentrations. This means that when high doses of acyclovir are administered, particularly intravenously, the concentration of the drug in the kidneys can become so high that it starts to crystallize. Dehydration is a major contributing factor, as it further concentrates the drug in the urine. Now let's talk about what's actually happening inside the kidney. After acyclovir is administered, it's filtered by the glomeruli in the kidneys. As the fluid moves through the renal tubules, water is reabsorbed, concentrating the acyclovir. If the concentration exceeds its solubility limit, the acyclovir precipitates out of the solution, forming microscopic crystals. These crystals can then aggregate and grow, eventually forming larger stones that obstruct the renal tubules, leading to inflammation and potentially kidney damage. This obstruction can cause a backflow of urine, further increasing pressure within the kidney. Acyclovir-induced nephropathy isn't the most common type of kidney stone, but its occurrence is significant, especially in certain patient populations. It's more frequently observed in individuals receiving high doses of intravenous acyclovir, such as those being treated for herpes encephalitis or disseminated herpes infections. Patients with pre-existing kidney problems, those who are dehydrated, or those taking other nephrotoxic medications are at higher risk. Unfortunately, precise epidemiological data is limited, but recognizing these risk factors is crucial for prevention. The signs and symptoms of acyclovir stones can vary depending on the size and location of the stones. Many people experience flank pain, which is a sharp, cramping pain in the side and back. This pain can radiate down to the groin and lower abdomen. Other common symptoms include hematuria, or blood in the urine, nausea and vomiting, and dysuria, which is painful urination. In severe cases, if the obstruction is significant, it can lead to a decrease in urine output and even acute kidney injury. Diagnosing acyclovir stones typically involves a combination of clinical evaluation and imaging studies. A doctor will take a detailed medical history, focusing on recent acyclovir use and any pre-existing kidney conditions. A urinalysis can detect the presence of blood or acyclovir crystals in the urine. Imaging techniques such as ultrasound, CT scans, or intravenous pyelograms can help visualize the kidneys and urinary tract, allowing doctors to identify the location and size of the stones. Sometimes, kidney biopsy may be necessary in atypical cases. Acyclovir stones don't typically fall into specific subtypes like calcium oxalate or uric acid stones. However, the severity of acyclovir-induced nephropathy can be classified in the degree of kidney dysfunction and the extent of tubular obstruction. The cornerstone of treatment for acyclovir stones is focused on reversing the crystal formation and supporting kidney function. This typically involves aggressive intravenous hydration to dilute the concentration of acyclovir in the urine and promote its excretion. In some cases, temporary discontinuation of acyclovir may be necessary. If the obstruction is severe and not relieved by hydration, more invasive procedures like ureteroscopy or percutaneous nephrolithotomy may be required to remove the stones physically. Alkalinizing the urine may also be considered to increase acyclovir solubility. Prevention is the best medicine when it comes to acyclovir stones. Maintaining adequate hydration is paramount, especially when receiving intravenous acyclovir. Monitoring kidney function closely during acyclovir therapy, particularly in high-risk patients, is essential. Adjusting the acyclovir dosage based on kidney function is also crucial. If possible, consider using oral acyclovir instead of intravenous when appropriate, as the lower doses typically result in lower urinary concentrations. The prognosis for acyclovir-induced nephropathy is generally good if diagnosed and treated promptly. With adequate hydration and management, kidney function usually returns to normal. However, prolonged obstruction and kidney damage can lead to chronic kidney disease in some cases. Recent research focuses on developing more soluble acyclovir formulations and exploring alternative antiviral agents with better safety profiles for the kidneys. Studies are also investigating the role of specific urinary pH and other factors that influence acyclovir crystallization.